Joining me now is Dr. Cesar Lara. He is a weight and age management doctor, which is kind of an odd statement for us, but go ahead and tell us exactly what that means, because we have other terms for that.
Yes. So I'm a board-certified bariatric physician and have a subspecialty in hormonal balancing. And so the weight management is really the way that I like to express that is not just about losing weight, but it's learning how to manage your healthy weight. And so that's why I call it weight management. And then the age management is really about how do we moderate, or how do we begin to effectively adjust the significant rapidity by which we age, by being able to control it, by being able to adjust it with appropriate hormonal balancing. And so obviously aging is a gift, and I don't like the term anti-aging, so I use the term age management so that I can help manage my patients effectively to age in a more effective and youthful manner.
Sure. We like to age slowly and perfectly, right?
Yes,
That's
yes,
what we're supposed
absolutely.
to do. And of course, we want these perfect bodies too, which means that I should be able to gain and lose weight whatever way I want. Nowadays, there's a pill, there's a shot, there's a potion. And so we're seeing a lot of people look for shortcuts or different ways to get that perfect weight. New study out says basically that there are ways that we can encourage people without actually having them in front of us. And you were telling me earlier about the practice that your practice does, which is basically visiting patients, but also allowing them reminders remotely. So let's talk about those reminders remotely.
So, you know, it's very important to have that physical contact with the patient. You get to sense what they feel like, you get to understand them, but more importantly, as you know, we need to actually do a physical and be able to understand their specifics. But when it comes to the challenge of not being able to release that excess weight or lose that excess weight is not as easy. It's a lot easier said than done. Sure. And so the actual success of that comes down to behavioral modification. And so that means that we have to hold patients accountable. And typically, in the traditional way that we were doing it historically, is that a patient will come to us on a weekly basis so that we can weigh them, we can give them their appropriate therapy, and actually the most important part of that visit was to educate, motivate, and counsel. And within the context now of the new development, we can actually do a large portion of that through what is now called telemedicine.
Now, when we look at this study, the American Heart Association just determined that obviously with weight loss there are better ways of doing things. Human touch, very important piece, but they also say that these electronically delivered comprehensive weight loss schemes or ways are also very useful. So give us an example of one of the things that you might see. So obviously we come into the office and you give me the physical and the blood work and we make sure that I'm healthy enough to lose weight.
Exactly.
And then after that's been established, now you're talking about, I guess, a reminder? What do you do with it?
So once we initiate the therapy, so in the first visit, we basically now understand what the deficiencies, what we need to do, and we implement a therapeutic plan. And now typically that plan would need to be followed on a weekly basis with an actual visit in the office. But now we actually have the option to give our patients a teleconference or actually a video opportunity for them to actually see our staff, see the physician, review their process for the week, and be able to get the education, the guidance that they need on a weekly basis, which really helps hold them accountable. But more importantly, it actually begins to decrease the barriers that unfortunately continue to be such recurrent in our patients and prevent them from being able to lose the weight, which is typically time. Time is a big factor, and so this decreases that barrier and allows us to more effectively educate and change behavior on a more timely manner.
Sure. So we were talking earlier, it's really not like a canned video. You actually have one of your staff members at the other end of this video conference. And so there's a real person asking questions, a real things going back and forth. A lot of these things, though, are canned, right? And so there's an educational portion of it or something else that the patient might lose interest in. It doesn't really fit them. It seems like you have a different little twist on that.
Right. The twist that we have on it is that it's still a very personalized way of educating and motivating the patient. So somebody may not have time to eat breakfast in the morning. Somebody else may not be exercising. Somebody else may be having other issues in their medical health. And with the telemedicine platform that we're using, we can actually hook up blood pressure cuffs. We can actually have electronic scales that are downloaded. They can actually begin to monitor what they ate every day. As long as they put the information in there, we can graph it and say you didn't eat enough protein, you ate too much carbohydrates, you didn't have enough adequate fats. So it does gives us a significant amount of good data by which we can then begin to make some actions that can create a significant output that gives them better outcomes.
Sure, and then we're looking at real time, so we're looking at these things. A couple of the apps out there, Fitbit has a great app. You were talking about Scales as a downloadable piece.
Yes.
A lot of things require us to put things in.
Yes.
And probably the biggest failure pattern I have anyway is I do it for a day or two, and then I stop doing it. So obviously having these reminders and pieces will allow us to keep the game plan in place and have those cheerleaders or someone pushing me in the right direction to make sure I finish.
And so my health coaches basically give you a call, say, you schedule to have a 2:30 appointment. So at 2:30, here comes the phone call. You can bring it in your phone. It's an actual face on the other side of the phone that you can actually have a real face-to-face, eye-to-eye contact. If you're, for some reason, you wanted to show us a rash, you can actually point it in that direction. So little things like that just make it a more personalized experience, but still the most important part of it is we're holding the patient accountable and we're basically making ourselves available in a more effective and efficient manner so that there's less problems with them not being able to get to the office or for some reason or another. I call them barriers. So we're decreasing the barriers to success.
And that makes great sense, obviously, because a lot of times we run behind the office a little bit, traffic's long, we miss our appointments, we're set back for a whole week, so this makes life a little bit better for everyone, including yourself, because you can keep on time and keep those patients in the right direction. Not to replace the personal one-on-one time.
Right, and as a matter of fact, within the context of this program, we expect that the patients will see us at least once a month in a real face-to-face, so we have an opportunity to actually touch, hug, evaluate, motivate in a very real sense, but then for the next 3 weeks, they will have the opportunity, whether it's once a week or twice a week, depending on the needs of the patient, we can actually make it more, make ourselves more available within the world of what they are able to do as far as their time.
Yeah, that's awesome. And of course, we always want to have access to the doctors. This is one way to do it. Great information. Obviously, we had a lot of barriers when we were trying to lose weight, a lot of things that we were held to standard-wise that we'd like help with a lot of times. So your practice does a great job on that. I've seen some of the outcomes, so beautiful stuff on that part. But certainly having the ability to dial up Dr. Cesar and go, hey, what's going on? What do you think of that? Well, I probably shouldn't say that. But anyway, great stuff. So I'm glad to have you today. Thank you so much for sharing with us.
It's my pleasure. Thank you so much.